So the oropharyngeal swab is performed in the patient's mouth. You ask the patient to open their mouth, say ah, and you swab what's called the posterior oropharyngeal wall and the tonsillar pillars. Now just be careful because the oropharyngeal swab will cause them to have a gag reflex. And while everyone is different, some people may actually cough in your face. So make sure that you're wearing the appropriate PPE in the case that they do so. This swab is definitely more tolerable than the nasopharyngeal swab, but it does require some more manual dexterity as you're going to have a tongue depressor to hold, a specimen tube to hold, as well as a swab. Sometimes you need a light, but if the room is well lit, then you probably don't need one. On the left, we can see that the swab goes all the way back and hits the oropharyngeal wall. And here I've circled it. On the right, the anatomy is the tonsillar pillars on the left and right. And then in the middle, you have your oropharyngeal wall. Try to avoid touching the uvula, the gums, and the teeth because they have bacteria there that can actually ruin the integrity of the swab. What I like to do when I'm performing this swab is I like to swab the oropharynx last. Why? Because if they cough, then I probably won't get another chance to swab their tonsils. So what I want to do is swab the tonsillar pillars, both the left and the right first, get a good sample there, and then go ahead and swab the oropharynx. That way, if they cough or if they have a gag reflex, you've already gotten all the samples that you need. Again, I can't stress this enough. Make sure you're wearing your PPE. You don't want to get coughed on, especially if a patient is positive for whatever you're testing them for. Alright, so here are the steps. Educate your patient as always, and open the swab. Now, I never just peel the whole thing open. I just open it a little bit so that I can remove the swab without contaminating anything. I have the tongue depressor in my other hand, and I ask the patient to open their mouth wide. Now, you don't have to ask them to lift their head. However, if they're sitting and you're standing, for example, you may need to ask them to reposition their head so that you can get a better view. Push the tongue down with the tongue depressor, and when you push the tongue down, you don't want to be at the front of the tongue because that actually just ends up pushing the back up and that'll obstruct your view. You want to be closer towards the back or the middle of the tongue when you're swabbing the patient. So place the tongue depressor in towards the middle of the tongue and push it down. Now be careful. Don't go all the way back so they end up having a gag reflex. You just want to be deep enough so that you can push the tongue down so you can get a good view. One of the things that I have the patients do is say ah until the procedure is actually totally complete. I've noticed that that will actually prevent or minimize the gag reflex. So get your view, hold your swab and your tongue depressor in separate hands, and get the best view possible. Swab the tonsillar pillars first, and as you're going back and forth, don't touch the uvula. Lastly, swab the oropharynx and remove in a steady motion without touching the teeth, gums, tongue, or uvula. Tell the patient that the procedure is complete, place the swab in media, secure it, label it, and confirm the patient date of birth and name. I will emphasize this one more time. Wear your PPE because if you get coughed on, it's not going to be fun. There are not many special considerations when it comes to the oropharyngeal swab. What I do want to say is that if there is a maxillary injury or an injury to the jaw, that's okay. However, they just have to have full range of motion or enough range of motion so that if they can open their jaw wide enough for you to get a good view. If they have an injury and they can't open their mouth, then you probably just can't do the swab. Some other things that you want to be careful of are any soft tissue injuries, ulcers, or cysts that you see in there. If there's any weird discoloration, bleeding in the oropharyngeal area, you want to avoid it. If it's in the other part of the mouth, that's okay, unless they can't open their mouth. Contraindications. If they just got their tonsils removed, definitely don't swab them with the oropharyngeal swab. If they've had their wisdom teeth removed, probably not a good idea either. If they've had any recent injuries to the mouth, then you want to avoid it as well. So it's also a clinical judgment. Even if your patient hasn't had oral surgery, hasn't had any injuries, but it just really hurts them to open their jaw because they're having issues with their teeth, then move on to the next swab. Be considerate of them and have a backup plan ready. This concludes the oropharyngeal swab, and I'm excited for you to join me with the mid-turbinate swab. I'll see you guys next time.